last class we started with plumbum. Hope you remember plumbum. And if you remember plumbum, this was the last slide where we had stopped. And we mainly focused on paralysis. Allah. And I also gave you a small brief up. Like plumbum, I will not typically discuss from head to toe. I told you I will be focusing mainly on 4 very important areas. Adರಲ್ಲಿ one area was paralysis, fine? And we'll also look at the other 3 areas. Now before I take up the other 3 areas in detail, ಆಯ್ತಾ ಏನು ಅರ್ಥ ಆಯಿತು plumbum? Or a quick revision, paralysis of plumbum must be we spend some 40 to 45 minutes. So what are all the symptoms you remember? Key points ಏನಿತ್ತು plumbum ಅಲ್ಲಿ? Okay, it's a remedy for convulsions. Yes, we spoke of GB syndrome. Good. Ascending type of paralysis. Very good. Either. Yes, that's also a very key point she is talking of. Paralysis of extensors. If it is flexors, very good. Netremur and causticum. 2 remedies if it is flexors. In plumbum, you have more of extensor group of muscles getting involved. So, ಏನಾಗುತ್ತೆ? Wrist drop and foot drop or ankle drop. Good. Better. Conversions from bad effects of masturbation. We spoke of that. And aura felt in? Okay, what happens to the left tongue? There is mainly paralysis. Swelling of the tongue is an aura you find in plumbum. Good. That's a point. Then paralysis associated with constipation, paralysis with coldness of the affected part, and atrophy of the paralyzed part, and paralysis giving rise to paralysis. These were few points we spoke of. And if you remember, we also spoke individually. Like for example, if esophageal muscles they go into paralysis, what will happen? Why there is constipation, why there is incontinence of urine, all those things we have discussed. Okay, so assuming the paralysis part is clear, I'll continue with plumbum. Now this is what we have discussed and this is what we decided, that plumbum will be explained under 4 important headings. One, nervous symptoms which we have discussed, and we are left with 3 small components of plumbum. One important thing is the gastric symptoms. I'll explain. And second thing that we'll be discussing is mind, the mental symptoms. And third thing we'll be discussing here is what is left over. As a final year student, keeping the clinical thing in mind, where else can one think of plumbum? That's what we'll be discussing. Okay. So any wild guess what happens in the gastric symptoms? What do you basically see in the gastric affections of plumbum? You'll have 2 very important things. One, I also was so much tempted because one of your friend already said constipation. Plumbum is a beautiful remedy for constipation. Okay, so we will discuss that, and before that, very good. Who was it? Colic. Good. Yeah, good. So 2 very important headings under which the gastric complaints will be predominantly explained in plumbum. One is colic and the second thing is constipation. Okay. Now before I take colic and constipation in detail, any wild guess what is this? Lead line. Very good. See now, if you recall your forensic, yes, if you recall your forensic toxicology part, lead poisoning, one of the important sign of lead poisoning is the blue line. Okay, the gums, the gingiva will have that blue line. Okay, so plumbism, in the poisoning, they come out with blue line. So luckily, if you have a patient who has this bluish line over the gums, one remedy you can think of is plumbum. So that's related to the mouth. Anything else that we have in mouth in plumbum? What else? Very good. Paralysis of what? Paralysis of palate. Good. Before palate. Tongue. Paralysis of tongue, paralysis of palate. Very good. So those two things can also be included under mouth. Now very important here is okay, I mean this is vomiting. I did not want to come out. I'll tell you why I did not want to come out with the content. Now why did I purposely avoid getting an image where the lady or the patient will vomit, and what is the vomiters you have in plumbum? So what do they vomit in plumbum? And why do they vomit this in plumbum? Two very important questions. What do they vomit? See, for you it looks more like nausea. Right? And if I tell you what they vomit, you will all start nauseating. Fecal matter. Very good. And that's one reason why I did not get the image. And getting that image is also very difficult. Patient vomiting fecal matter. Okay? So, in plumbum, there is vomiting of fecal matter. As a final year student, why do you think this is happening? Very good. One of your friends quickly says obstruction. Good. You stick to that point, obstruction. Anything else that you can think of? Yeah, your friend Geeta says reverse paralysis. Okay? Fine. So there is reverse paralysis. You know, this is against nature. Allah? From your physiology knowledge, peristalsis happens in the lower direction. Now what is happening here? Peristalsis is happening in the upper direction, which is reverse. So because of intestinal obstruction, because of intussusception, we'll talk of that a little later. So what is happening? The intestines are obstructed, there is reverse peristalsis, and the fecal matter is vomited out. This is very important. Okay? Very rare to get such situations because it is a surgical emergency. They rescue a surgeon rather than coming to a homeopath. Okay? If you are lucky, please do remember plumbum. 2 or 3 more remedies should come to your mind in this situation where a person is vomiting fecal matter. Huh? Very good. Your friend is talking of roughness. Good. But you agree with roughness? What happens in roughness? What happens in, see, roughness, beautiful, good. I am happy you spoke of roughness, but what happens in roughness? In roughness, they will not vomit fecal matter. There is an obstruction of flatus. Fine? Flatus is not going up or flatus is not going down. Incarcinated flatus. Fine. It is neither going up nor coming down. So roughness will not have this serious pathology. It is not that deep acting remedy. It's more functional, meaning, you know, there can be accumulation of gas, nothing beyond that. But here, what is getting obstructed? The intestines are getting obstructed. And one part of intestine is sliding into another part, which we call it as intussusception. So it's a serious surgical condition. Roughness has no role here. Okay, fine. Roughness has that post-operative gas pains, gas getting accumulated, almost like cinchona. It's not going down, it's not coming up. Fine. Obstructed flatus. That's more of roughness. But good, you brought in roughness. Okay. So the other remedies. Asafoetida, what is that you also have in asafoetida? Yeah, asafoetida has reverse peristalsis. And the burp in asafoetida is very loud. Asafoetida, ingu, which we all know from ages, it's a beautiful remedy for gastritis. Hysteria, you all have it in asafoetida. But asafoetida will have loud eructation, loud burps. But the remedy which has the capacity to cause this vomiting of fecal matter. In plumbum, there is vomiting of fecal matter with colic and constipation. Which are all the other remedies? 2 remedies at least should come to your mind. I was expecting minimum opium. Okay? Naxvamika, opium and plumbum are the 3-mark medicines in your repertoire. There are few more remedies like belladonna, colchicum and bryonia. But Nux, opium and of course plumbum, you need to remember. See, moving ahead, we'll focus on the colic. One of your friend said colic mainly in painters colic. What is the understanding? Yeah, very good. Good. I am happy. Colic which comes from lead or lead poisoning. As you wish. Lead poisoning. So that's one possibility. What else can bring in colic in plumbum? Lead is one possibility. You also have exertion. Colic which comes from constipation. Whenever the child, the patient is constipated, they will have colic. Once he passes stools, he will be fine. Okay. So, idu causu and what is the character of pain? This is something very important in plumbum. The pains are very violent pains. The colic, violent pains, one though. Second thing is wandering pains. More than wandering, what you have in plumbum is they keep extending. Colic pains from abdomen, it extends to the entire part of the body. You are getting this situation? Colic pains in the abdomen which is extending to the entire part of the body. I have mentioned somewhere here. Whole body. Or colic extends to thighs, feet, genitals, lower limbs or the whole body. This is very important. More than this, where we indicate plumbum in our practice. See, many situations we have patients coming and telling, so much of pain, I feel as if the abdomen is pulled. Typically they tell you like this, okay? They feel as if the abdomen is pulled. Meaning, in our material medical language, what he is trying to tell you is, the abdominal wall, fine, is being pulled. So, sensation as if abdomen wall was drawn by a string to the spine. Okay, so see, this sensation is very important in plumbum. So what is that sensation? I hope you are clear. What is that feeling they have here is, the abdomen wall they feel is being pulled back. They may not typically tell you like, with a string and all those things, but that feeling is enough for you to prescribe plumbum. And what is that feeling? They feel as if the abdomen is pulled back. Suck, that is plumbum. So colic. See, we have many remedies for colic. Any quick remedies for colic? Lycopodium, Porophyllum, Colocynth, Macphos, good. Very good. Diascoria, right? Stannum, yes, agreed. Allium cepa, lot of remedies. Okay. For example, how is it in Colocynth? Okay. More than bending back, what is the cause for colic in Colocynth? Very good. Suppression. Good, good, beautiful. Suppressed anger. Indignation. Something wrong is happening. He gets angry and he lands up with colic. I had a case or two, where we had given Colocynth. Typical situation. They get angry and then they get pain. And the Colocynth modality. What is the modality? Better by bending double. Okay. If it has to be Macphos will not have this causation. First thing, Macphos will not have this typical causation. Fine. And in Macphos, what is the specialty? Colic better by heat. Warmth. Many girls, dysmenorrhea, they keep that hot water back and they feel better. That is more of Macphos. In Allium cepa, colic is because of eating cucumber. Good, beautiful. Colic after eating cucumber, salad is more of Allium cepa. Okay. Next one, Mika. Colic with ineffectual urging for stool. What is the cause in pulsatilla for colic? Fatty food, very good. Oily food. See, now this is how patients come to our clinic. And you should know what is the cause, how are they presenting to you with, and there are acute presentations. You should not miss. If you can't show results in acute, patients will lose confidence in you. Chronic will have time. 10 साल से है, चलो अभी 10 minutes से है, and it is an emergency. You have to show results there. And homeopathy is capable of showing results. It is only the homeopath who should be trained to show that kind of results. So acutes or medicines works wonders. Fine. So what I was trying to tell you is this kind of feeling Though you are a final year student, you should be knowing 150 to 200 medicines, but never you have come across this feeling, that that sensation as if drawn in, abdominal wall drawn in, that feeling you never had. Somebody was using the remedy diascoria, which is exactly back. Colic better by bending back, exactly opposite to colocin. Fine. So somebody in your clinic says, sir, I feel better doing like this, then please don't give colocin and blame homeopathy. You are getting my point. It's a different position. You should know. Now, colic aggravation during menses, and another beautiful modality you have in plumbum. Colic better by stretching. And if you read Allen's keynote, he says, Dr. Allen says, they stretch for hours and they feel better. Stretching. Colic better by stretching. Okay. Better stretching, which is other remedy? Common remedy, general remedy. Any complaint is better by stretching. You should just use your common sense. What is stretching? What is stretching? Stretching is a movement. And which is the remedy? See, everything cannot be given to you directly. You should use your common sense. What is stretching? Fine? It's a movement. And in which remedy movement they feel better? That is Restox. You getting it? Okay. So we'll get back to plumbum. I'm talking to you about the colic part of plumbum, and colic which starts in the abdomen and it extends to the whole body. Very characteristic. Okay. So moving ahead, we also have a symptom here. Is this visible? This is, yeah, hernia, but which hernia? Inguinal. Okay, I hope this is not blocking. See, this is umbilical hernia. Fine. We are talking of another surgical condition where plumbum can get indicated. Umbilical hernia, inguinal hernia. Okay. Now what are the complications of hernia? Yeah, good. You need to be quick. Strangulation. I mean, I many times have shared this case during my initial days of practice. It is a case which even today chokes me. Meaning, we had a lady whom I was treating for hernia, and it was an inguinal hernia, and one fine Sunday morning, the son called me, sir, your patient, my mom, she is not better, she has got some pain, she has got a lot of discomfort. Then I told, rush to the clinic. I also came to the clinic, opened, saw, and unfortunately she was in bad pain. Now how will you diagnose that she is going into strangulation? That's also very important. Okay? You are getting my point. Fine? She had bad pain. But how do you decide that she is going into strangulation? And how do you decide that this is not coming into my boundary and I need to refer? Luckily, I waited for 15 minutes, 20 minutes, gave opium, gave aconite, did lot of things, but nothing happened. We were losing the case, so immediately we had to rush her to the nearest nursing home, and we got her operated. Okay, fine. So one of the few cases we have, one of those flop cases. Unfortunately, it was my limitation. I could not understand. Could not understand means I knew it is strangulation, but I could not help. Okay, so she had to be rushed. Now this is the beauty of studying allied subjects. This is the beauty of going to allied hospitals. You know where you put a mark. And if you don't understand the seriousness, you may still ask her to wait, and then it will become a big crime. You might lose the patient as well. Okay? And this is one case, though I was saying, I felt sorry, but I had to take a quick decision and we referred her. Now how do you decide if she is going into strangulation? That was the question asked. What is it? How do you decide? As a final year student, how do you decide that this patient is going into strangulation? Huh? You have already done this in your third year, surgery. So it does not mean surgery is over, third year is over, you forget. Very good, sudden onset of the pain, which she had, apart from that. See, she was, how will you make out the color change? Where? Inside? That area. See, like, this is a pathology which is happening inside. Fine? So at least externally you will not see anything. But what you need to understand is, see, she was going into a shock. Meaning, I gave you a lot of clue. Many times my finger was on my radial pulse. None of you noticed this. She did notice, she did not have the courage to tell. What if I am wrong? And what if this man scolds? See, like, her pulse rate was dropping. And worst part was her BP. BP, 60-40. And it was proportionate. Her pulse rate was decreasing and my pulse rate was increasing. Her BP is decreasing. If you would have checked my BP, then it was high. Very unfortunate. Fine, but we could not help. I did try with aconite opium, whatever knowledge I had then. Strangulation or strangulated hernia, I did give, nothing happened. Rest there, the surgeon came, he opened, he did the repair, and luckily we could save the patient. So please do understand the limitations of homeopathy. Fine. And you'll understand the limitation of homeopathy if you know the allied subjects better. Okay. Fine. So strangulated hernia is what even in Plumbum Met is given. I did not use Plumbum then, but umbilical hernia in children, inguinal hernia in children, inguinal hernia in elderly people. Okay. I have good results with umbilical hernia. Fine. I have used Nexformica, I have used Calcarea based on the totality. Inguinal, 1 or 2 cases. One case, I have the ultrasound reports also. One case beautifully cured with Veratramalp, constitutionally. Okay. But please do understand your limitation. Please guide the patient correctly. Tell him, this is what, if something like this happens, whenever emergency sets in, you'll have to get back to me or get back to the hospital, whatever. Okay. So inguinal hernia, umbilical hernia. You also have it in plumbum. This is intussusception. Okay. Fine. Intussusception, one very important indication, there's something I missed here. Intussusception with white coating of the tongue. Plumbum is the only remedy given in your repertoire. What is it? Intussusception with white coating of the tongue. Only remedy. So remember that. And we will look at the other part of plumbum gastric, and this is what I was trying to explain. Constipation. You all know why there is constipation in plumbum. Okay? The rectal muscles, they go into weakness, they go into paralysis. Okay? So naturally you can see the pain this patient is going through. It is not coming easily. He has to strain a lot. Okay? He has to strain a lot. Stools are very hard and they are black like sheep dung with urging and tearing in anus. There is so much of urging, literally the anus is getting torn. Fine? He has to strain so much. That is plumbum. See, every remedy which has constipation has something special or it has something unique. And only if you can consider those unique points in your prescription, only then it will work. Recently I had a case of a man, 50-55 years old man. He had bad constipation and he had got even that laxative. What is that laxative allopathic doctors give? Cremafin. He had got that pink syrup, Cremafin, and he told, Dr. Saab, if I drink this, I can pass. If I don't drink this, 3 days, I don't pass. Okay? Which is the remedy? Don't tell me potentized Cremafin and give him. Bryonia. No issues. See, Bryonia has its own character. How is it in Bryonia? No, see, before you jump to the remedy, what you need to understand, please understand the process. Like I told you, I was keeping my hand on my fingers and my radial artery. None of you observed. What is this? In spite of taking Cremafin, or only if I take Cremafin, I can pass those. During olden days, cremafin was not there. Now what is cremafin? It is a very good, it's a laxative. Now how do you convert this? Only if I take a laxative, I can pass stools. If I don't take laxatives, I can't pass stools. Fine? There is a remedy. Same line they have given. Okay? And that's what I keep telling you. The advantage of being a teacher is we get an opportunity to refer books. And we bank on that opportunity. And that remedy was given to him. And it's almost 15 days now, he is not using cremafin and is passing stools daily. Now what is that remedy, or before the remedy, only if he takes a laxative he can pass, otherwise he can't pass. Only remedy that we have in our Materia Medica, it is not there in repertory, it is there in Fatak Materia Medica. What is it? No issues, MacCarp, no problem, it's not MacCarp. But at least I am happy you could think of something. And I am sure there should be some thinking happening behind giving MacCarp. Good. But the remedy is not MacCarp. The remedy, please remember, 2 to 3 cases I have used this situation, luckily, and the remedy is lac defloratum. Do you have it in your syllabus? No, don't feel shy. Do you have it? No. If it is not there, don't worry. Tomorrow you can't tell your patient, uncle, it's not there in my syllabus. You can't tell that. Fine, but lac defloratum is the remedy you have to remember. If you get this situation, it works beautifully. Okay, lac defloratum. So, bad constipation in plumbum. Again, constipation, a lot of remedies. As a final year student, you want me to compare some remedies? Remedies of your choice. Very good, platina, good. How is it in platina? Platina? Constipation in travelers, good. Travelers constipation. Okay, good, platina. Alumina, how is it in alumina? How is it in alumina? Okay, clay. What is at one point? Constipation for soft stools. There are a lot of things in alumina and I got nothing against. Constipation for soft stools. What do you understand by this statement? So they are straining. For what stools they are straining? Even soft stools. Ideally for which stools you strain? Hard stools. And the patient is shocked, sir, I am straining so much, but canicula, soft stools. So that is alumina. And exact opposite is Bryonia. Good. Your friend was talking of Bryonia. Dry, hard, knotty, fine, as if burnt, very hard stools. Okay? Chalo. Bryonia, platina, Silesia. How is it in Silesia? Okay, good. Silesia is a shy constitution. So क्या होता है? Motions will come and out of shyness motions will go. So stools which partially comes out and gets in. Silesia. Good. But what else you also have in Silesia? See, trust me, patients will come and tell like this only. Sir, it is so embarrassing, I have to use my fingers to remove. Fine? So this is what it means. Mechanically means they remove with their fingers. Stools have to be removed mechanically. There are a lot of remedies. Silesia, one more? Tuja, good. One more, recently we spoke. It also has Silesia in it. Very good, good. I know. When nobody answers, I look at him. Good. Sanicula. Good, Sanicula. Sanicula, calcarea. What is the specialty in calcarea? Yeah. 7 din, no motions. Calcarea is very happy. 8th day he has to pass motions, then lot of symptoms will come up. Better when constipated. See, one word constipation and see the variations we have. We have just touched few. There are plenty of remedies in our Materia Medica. And each patient will have its own. Yeah, you also have opium. Opium, obstinate constipation. Fine? Obstinate constipation. And it will come in balls. Sheepdom. Yeah. Small balls like. You have opium. Okay, there are a lot of remedies which we can keep discussing. Fine? So in plumbum, this is how it is. Yeah, probably this slide it has come up now. Intussusception with white coating of tongue. Only remedy. And because of intussusception, if there is vomiting of fecal matter, the remedy is Cupromet. The remedy is Cupromet. Okay. Now, little about the mind of Plumbum. See, find the student. I'll just give you a brief, note on the mind of Plumbum. And I also have 1 or 2 cases of Plumbum that I have used in my clinic. I'll be sharing a little later. Now, what you need to understand here in Plumbum is, basically they are very timid people. Okay, I mean less courage. They are not very courageous people, very timid people. Fine, introverted, shy, quiet type of people. Okay, and uses paralysis, and when the paralysis happens, the functioning gets slowed down. There is paralysis of mind. I mean, not paralysis of mind. Don't write like that in your exams. But what I am trying to tell you here is, there is slowing. Okay, there is slowing down. The thinking, all the processes of the brain, they are slowed down. So the understanding, fine, comprehension, thinking, everything gets slowed down in Plumbum. And one more component that gets affected in Plumbum is memory. Naturally, you are not understanding, fine, and naturally you are not able to retain. So ultimately the memory gets affected. Memory weak, forgetfulness, all those things will come up. Slow perception, slow comprehension, these are the words used in your books. Very characteristic in Plumbum is this is something very interesting. Now what is that they have in Plumbum here is, they have a fear. And what is that fear Plumbum has is, fear of being assassinated. Assassinated means fear of being killed. Okay, you should have heard PM of that particular country was assassinated. Okay, so fear of being assassinated, fear of being killed, fear of being murdered. This is very strong in Plumbum. So I have taken a few symptoms related to this from your repertory. Danger to his life. Okay, they feel there is danger to his life. He will be murdered. Others are conspiring to murder him. And see the beauty of the last sentence. Everyone around him is a murderer. Okay, see the thought process of Plumbum. He feels he will be killed. Why he feels he will be killed? Because he has got a lot of things. He feels his life is in danger. He feels people around him are all trying to kill him. Fine? And and he will be murdered. So this is a small thought process you have in Plumbum. There are a lot of other things. He acts sick, feigning sick. Feigning means acting sick. You have school. Okay, Amma, fine. Once the school bus goes, fine, feigning sick. You act as if you are sick. Okay, so that's one thing. And no interest in life, apathy, boredom, all those things you have in Plumbum. Plumbum mind for a final year student, the examiner will focus more on the paralysis. Okay, that's why I have dedicated 45 minutes. Sure shot question that will come up in your exams. And other things you should know. Just because it is not important for your exams, it may be important for your practice tomorrow. You should know that everybody will murder me, fear of being assassinated, weak memory, slow perception, slow understanding, all those things will come up in Plumbum. Okay? Now before I take up the last part of Plumbum, which is very interesting, 2 things we spoke. We'll have a quick revision of what we spoke, and if you are clear with what I have told, I will take up the third part. What was the first part we spoke? GA. GALE, any questions? See, go very systematic. Acting on GA, they are all images. It should just fall in front of your eyes. GALE, it will cause constipation, colic, 2 things. And explain both individually, or you go from mouth downward. So when you are talking of mouth, what? Bluish line over that gums. paralysis of tongue, and naturally there can be paralysis of throat. So food is coming out. That's also a possibility. Under stomach, what did we see? Under stomach, yeah, vomiting. Vomiting is because of what? Intussusception. And what are they vomiting? Fecal matter. They are not vomiting food, they are not vomiting bile, they are vomiting fecal matter because of reverse paralysis. Very good. And two more important remedies, Naxwamika and opium. Good, Naxwamika and opium. Adu, stomach. And in the abdomen, what did we see? First word, very good. In the abdomen, we saw colic. Colic because of what? Yeah, leg do, exertion, when they are constipated. Where is the pain? Where is it going? From abdomen, it is going to the entire body. Okay. There is also constipation. What is it? Okay, and we also saw intussusception. We saw hernias under abdomen, and of course we also spoke of constipation. Very bad constipation where the anus is literally tearing away. Very painful, hard stools related to constipation. Okay. Now, in the last heading, I am trying to mix everything, meaning whatever is left out and what is important under the heading miscellaneous, we are trying to club everything. Okay. So what are we trying to do here is, here we are looking at a very important point, and what is this? Arteries, and there is plaque formation. Okay. Atherosclerosis. Atherosclerosis. Plumbum is a very important remedy. Arteriosclerosis, atherosclerosis. Any other remedies you can think of? Very good, beautiful. Barretta. Don't forget Barretta. Barretta mure, good. Barretta mure, conium. You can also add plumbum. Atherosclerosis. Atherosclerosis, what happens when there is atherosclerosis? Very good. Heart has to pump with force. So the direct effect will be hypertension. So hypertension from atherosclerosis, one of the remedies you can think of here is plumbum. Though you also have Barretta car, Barretta mure, conium, lycopodium and other remedies. So one is this, you can remember this. Now, a beautiful indication of plumbum. Yes, right. Abortions, good, beautiful, abortion. Now, can we have some quick input? Yeah, 1 second. I mean, now that we have some 5-10 minutes and a final year student, very practically if you analyze abortion, okay, why abortion happens in plumbum? Okay, I know there is so much of paralysis that I have told. You'll all think only of paralysis. So paralysis of uterus? Why? Okay. See, one of your friends says, I mean, he is partially right. I appreciate that point. He says, yeah, very good, good. I mean, see, now what happens is, see the situation in plumbum. That's why I wanted to bring it to your notice. We could have just told abortions and we could have left. But why abortion is happening in plumbum? And if time permits, we'll talk of other remedies having abortions and how are they different from plumbum. See, plumbum, there is no issues with the ovum, there is no issues with the sperm. Zygote is getting formed, and fetus is also getting developed. But what is the issue here in plumbum? The issue is with the uterus. Now, if you just go back to your physiology, as the fetus grows, the uterus it has to expand to accommodate the growing uterus. The problem is not with the fetus, problem is with the uterus. Fine? And when the scan is done, fetus is 3 months, yes, 3 months, all developments fine. What is not getting developed here? Uterus. The gynec might tell, boss, fetus is fine, your wife's uterus is not developing. Now this is the situation you have in plumbum. Only remedy, remember, you get this situation tomorrow in the clinic, no allopathy can help. Okay? What maximum they tell you is your egg, your sperm and Surrogacy. Somebody sells womb and let it grow there. But why the mother should miss her motherhood? It's a beautiful feeling, no? What the mother, not everybody will get that feeling. And not everybody are prone to enjoy it. But why should she miss? Probably a few doses of plumbum, okay, can do wonders. And given in E.F. Harrington, a great author, given in Clark, given in Allens. So it is a very important symptom observed by the stalwarts, and they have given it to you. So don't question the authenticity of this particular symptom, okay. But at least I have never got an opportunity to use this in my patients. But it does not mean others should not get it. For example, you get this situation where the uterus is not growing to accommodate the growing fetus. The remedy is plumbum. So what is happening? The fetus is nicely growing. The uterus is not able to accommodate. So uterus will contract and it will expel. That's why abortions are happening in plumbum. Please remember, very important. I hope you got clarity here. Okay. Similarly, there are other remedies. You also have Barretta. Now, what is the problem in Barretta? Barretta, like plumbum, will have atrophy of uterus. What is it called? Hypoplastic uterus. What is it? Hypoplastic uterus. Meaning, the uterus has not developed according to the age. You are 30, you are 25, but your uterus of the size of a child, 11 years, 12 years. Fine, that is Barretta. Okay. So Barretta also should come into picture here. Okay. So abortion, please remember plumbum. Don't write first. See, now the beauty. Can abortion in plumbum happen in first trimester? See, try to understand. If you open your repertory, abortions in second trimester. You are getting it? Now this is what, as a homeopathic student, you should start thinking. Why in plumbum it is not happening in first trimester? Fine? See, first trimester, the growth will not be that big. See, the growth you see more towards the second and third, fifth month, sixth month, and then you see the growth happening. So in plumbum, you have abortion during fifth month. You are getting this point. Now this is how you should start thinking. In Apis mellifica, you don't have abortions during sixth month. In Apis mellifica, you have abortions during first trimester. Actia racemosa, they have abortions during first trimester. Arnica, aconite, calicar, there are different set of remedies. In plumbum, it's a different story. Are you clear, all of you? Uduguru in there? Clear? Fine. So we'll go ahead and plumbum, please remember this. This is very important. It's also a remedy acting on the glands. Acting on the glands. What will plumbum do acting on the glands? Okay. It mainly causes atrophy. It mainly causes atrophy. You can see the uterus, the testes, the ovaries, they all get atrophied, small. Fine. Uterus is atrophied, testes is atrophied, ovaries, any gland in plumbum, it is atrophied. Fine. You don't see enlargement in plumbum. You mainly see atrophy. Okay. So moving ahead, what you also have, tendency for abortion from undeveloped uterus. Your friend was trying to tell there is no room. Absolutely right. Uterus is small. There is no room for the growing fetus. So the mother is aborting. Plumbum. Only remedy. Fine. Okay. And skin. Here I would like to share a small case. Case of one of our patient, she had gangrene. Now gangrene was here. The tip of the finger had gone into gangrene. Okay. If you look into your repertory, gangrene under extremities, under fingers, you have only two remedies. One is sickle and one is plumbum. So both the remedies I tried. Unfortunately, it did not help in that particular case. But that lady improved very nicely with sepia. Okay. See, wherever I have used plumbum in my practice, I am just sharing it with you. Okay. So it will also, you'll also know tomorrow you have some lady with patient with gangrene of the finger. At least two remedies will definitely come to your mind. One is sickle and the other one is plumbum. What is the specialty of sickle? One word. What is the specialty of, what is it? More than that. In sickle it is dry gangrene. Don't forget, keyword, dry gangrene. It would have become like stone, dry gangrene. Sickle. Yeah, I know the part is cold, all that is fine. But the type of gangrene in sickle is dry gangrene. Don't forget this. Okay. So that lady ultimately, we took her case in detail and she is doing beautifully well with sepia. The surgeon had asked her to chop it off. They do amputation. Any other platform I'll share with pictures. We need to take the permission from the patient also. And if she permits, I can discuss that case in detail. How beautifully gangrene is going away, granulation tissue is coming up. Fine. What the improvement with photographs you can see. Fine. Sepia was the remedy given there. So what will plumbum do acting on skin? See, like sickle, you have few things here, shriveled, wrinkled. See, so nicely it is told, and drawn over the bone. Meaning, the skin is drawn over the bone. Hardly any flesh. It's all shriveled, dry. Generally, plumbum patients also look very thin, very lean, very emaciated. Okay? Now, this is the first point. Second thing is a very good remedy for bed sores and gangrene, which I just shared a case. Okay? Bed sores and gangrene. This is what it happens on skin. The last part, this is what we started, if you remember, plumbum. What did we start with? We started with a case of CKD and I'm ending plumbum with the kidney affections. So it can be a remedy for CKD, it can be a remedy for chronic renal failure, nephritis. What were the indications? Very good. Kidney failure with hypertension, with high blood pressure. One. And second thing is kidney patients who go into emaciation, who go into debility, who go into weakness. CKD patient who is very lean, thin, emaciated, feeling very weak. If other things agree, you can think of plumbum. Okay? So I'll just read the text for you. Bright's disease with rapid emaciation, excessive debility, contracted kidneys, renal failure with hypertension. So these are few indications of plumbum related to kidneys. Okay? Now before we close, I was just going through Dr. Clark's Materia Medica and he has given you a huge list starting from A to Z where plumbum can get indicated clinically. Starting from anemia, there are plenty, you will be shocked, at least I was shocked when I was referring Clark. So many things. Abscess, hernia, umbilicus, uric acid diathesis, vaginismus, must be few more things are missing. A lot of things. Sciatica, spine affections, multiple sclerosis, lot of things you have here in plumbum. Anemia, there's a mistake with the spelling, aneurysm, softening of brain, tumors of brain, okay, a lot of things. Cystitis, dysmenorrhea, ganglion. Which are the better remedies for ganglion? Very good, benzoic acid. So I am a guy who give more of constitutional treatment, but benzoic acid is one, and one more as a final year student, you should remember. Rota. Good. Calcareous floor, nothing wrong. Calcareous floor, when do you think of calcareous floor in ganglion? Hard. Yeah, your friend is telling hard. Stony hard, yeah. You touch, you feel it is stony hard. Never hesitate giving calcareous floor. It should not be benzoic acid, it should not be rota only. They have their own indications. But hardness, remember, always calcareous floor. There are better remedies. Okay. But calcareous floor is one remedy which is having hard indurated affections. Okay. So hernia, strangulated hernias, headaches, we got plenty of things in plumbum. Any questions, anything you want me to clarify in plumbum? So to sum up, as a final year student, focus is on paralysis. A 5 mark question. Okay. And all these things that I've shared today, they can be viva questions. Somebody can, if I come, I might ask you, tell me the vomiting of plumbum. Fine. Don't tell me bile, sir, food poisoning. You know, when I'm asking you plumbum vomiting, I have something special in plumbum in my mind, and that's what I expect from you. I might ask you abortion of plumbum. Fine. Sir, 3rd month, 2nd month, spontaneous abortion. Sir, aftershock abortion. You know, plumbum has something very characteristic. Fine. Similarly, constipation, intussusception, hernias, okay, gangrene, skin, kidney. I might ask you kidney affections. You know, hypertension associated with renal failure, or kidney affections with kidney affections with hypertension. So generally, when kidney is affected, BP will be high. It's a common symptom. But in plumbum, it is exaggeratedly high. High blood pressure, almost like malignant hypertension with kidney affections. You can think of plumbum. High BP. Okay. Any clarifications behind? Ella clear? We'll stop. Anything to ask? Chalo, thank you then.